Hey everyone, it's Dr. Rick, and today's topic is going to be centered around activity. So those of you who have come to me in the integrative medicine clinic, there's always going to be a balance of how to get back to where you were before as far as youthfulness or not having any diseases. And unfortunately, activity is going to be one of the crucial links that gets you there. Some of you haven't exercised ever. Some of you are very good with your exercise, at least up until the injury or the disease process. The objective is to personalize an exercise routine. The country is opening up again. We're allowed to go back to the gyms and safe gyms. I love endorphin effect, and I think here we take care of our clients, patients, and we make sure that you're healthier when you leave than when you came in. You can go to other big box gyms, but if they don't have the right talent to give you coaching as far as how to fine tune things, then you're just going to be at risk for either overtraining or utilizing all your efforts and not getting anywhere. This is my hierarchy for trying to develop a personalized program for folks. That doesn't just mean exercise, it also means nutrition, mindful practice, and some form of maximizing on deficiency or sleep. Now, if you haven't done all that stuff, we'll talk about that in other videos, but just with regards to exercise and introducing you back into the gym, the hierarchy usually is starting with a coach or a doctor, figuring out where you are as far as if you're a total couch potato or if you're coming back from an injury. We look at those weaknesses, your limitations, and then we build on that. The next step is always going to be trying to entertain or develop lactic acid tolerance. Now, stamina can be the fact that you haven't been to a gym in a long time, or you can't walk a block without shortness of breath because you have a lung disease, but that still can be worked around. We just have to develop a template so that you're safe, you have progress, and we can get to an ultimate goal, which I'll show you in a second. Strength will always be following stamina once you develop lactic acid tolerance. After strength, flexibility. After flexibility, power. And finally, I think that everybody before graduation should hit some form of cardio. Your resistance guys are probably shrugging and saying no, but I think it's important, especially as you age. Resistance exercise, which I love, but it can't just be that. It has to be a combination of several things. And finally, calm. Doesn't mean you have to meditate, but we have to develop a personalized program for you. Sometimes, upon getting to power, people get injuries. Or, worst case scenario, if you have balanced everything and you age, the aging process might put you back into trying to reconfigure what to do in the gym or how to use these pieces of equipment. So again, it's important that you have the facilities to do what you have to do. And don't get me wrong, if you're outside the state, outside the country, or just not financially ready for it, you don't have to belong to a gym, but you do have to invest in using things in your environment to give you that resistance, that cardio, and that flexibility. We can have Smith machines to not need a spot. You can get on a treadmill. You can take a yoga class. The problem I see is that you have to be able to progress. I think when you progress and you continue to have summits that you challenge yourself with, you're bulletproof. Now, diseases will always come up and might have to be fine-tuned. At least if you have a good basis and you're grounded in cardio, resistance training, and calm practice, I believe that we can get you anywhere else you want to get to. You have to have that nugget of tolerance and a little bit of insight. Now, even if you do isometric exercise, I have this thing called muscle yoga. Usually in yoga, you'll hold the pose and maintain as best you can with as little effort as possible. But in mine, I like to hold isometric contraction. So for those that don't have access to a gym, you can still use isometric. You can use eccentric or concentric movement, and maybe even resistance bands. But I think there's a top off to that. And if you don't challenge with further resistance or power development, you might not optimize your true potential to be bulletproof to future diseases. Being anchored in the basis of exercise, calming practice, disease modifications, you don't have to be an expert, but just being anchored in commitment to exercise will be the first step. If you can get a good coach behind you and a facility to entertain cross-training, I think that'll be the highest possibility for success. If you have any injuries or you've been plateaued and you tried a couple things, but they haven't worked, put them in the comments down below. Maybe I can entertain helping you get past that plateau. Otherwise, thanks for watching. Don't forget to subscribe, and I'll see you at the next video.